Morning, everyone. It's good to see everybody. Steve, I'm guessing we're just waiting on quorum for a bit.
Yes, give it another 2 or 3 minutes.
Great, thank you. Hopefully everyone's received the agenda materials. If anything's needed, please do let us know. But happy to have you all here.
Good morning, everybody. This is Tina Lopez. I'm the administrative assistant, and I see somebody in our meeting with CS Host 500. Can you identify yourself for the meeting minutes, please? Appreciate it.
Looks like she just logged off and back on. That's Chela Schuster.
Thank you.
Thank you very much.
Okay, Michelle and Stephanie, we do have quorum, so we could commence the meeting.
Thank you. Good morning, everyone. Welcome to the Continuum of Care meeting. Let's call the meeting to order. I have 9:33. My name is Michelle Jamison, and I am with US Vets, and I'm the co-chair of the committee along with Stephanie Smith with Native American Connections. We will start with the introductions, and so I will call each committee member name and ask you to introduce yourself and your organization. And let's start with Stephanie Smith.
Good morning, everybody. I'm Stephanie Smith with Native American Connections.
Good morning. Adrian Clark. Okay. Stephanie Crum. Okay.
Good morning. Can you hear me?
Oh, I can.
Oh,
yeah.
sorry. I think I was trying to hit the mute button. This is Stephanie with Human Services Campus, Stephanie Crum. Good morning, everyone.
Good morning. Kathy Donalfi.
Hi, Kathy Donalfi from Anuli.
Good morning. And Alfred Edwards.
Good morning, everyone. Alfred Edwards from DES.
Good morning, Alfred. Dolores Ernst.
Good morning, everybody. This is DC Ernst with the City of Phoenix Fire Department Crisis Response Program.
Good morning. Trisha Gibson. Okay. Wendy Johnson.
Wendy Johnson, Justice Center.
Good morning, Wendy. Anne Marie Johnston.
Anne Marie here from Community Bridges.
Hi, Anne Marie.
Hi.
Laura Magruder.
Good morning, everyone. Laura Magruder with Maggie's Place.
Good morning. Jennifer Page. Aaron Rain.
Aaron Rain, City of Mesa, City Manager's Office.
And he's sitting in his, joining us from his vehicle this morning. Good morning.
Always, that's my new office.
Nikki Ramirez.
Nikki Ramirez, Chicanos por la Causa.
Tama Reily. Tama, sorry.
Good morning, everyone. This is Tama Reily with Arizona State University.
Good morning. And Ty Rosensteel. Okay. Chela Schuster.
Good morning. This is Chela Schuster with Community Solutions. And I'm sorry, it won't let me change my name on here. So yeah.
Okay. Morning, Chela. Sarah Sims. Laura Scott Nicky.
Laura Scott Nicky with Save the Family. Good morning.
Good morning. Stephen Sivers.
Good morning, Daniel Davis, proxy for Stevens Divers.
Okay. Hi, Daniel. And Joanne Thornton. And Craig Tripkin. I would just like to say that I've really improved on the pronunciation of names, so I'd like to give myself kudos on that. I think I've gotten a little bit better, so thank you. So now we'd like to just call out the MAG staff to introduce themselves. Steve Dudasek.
Hi, Steve Dudasek from MAG.
Morning. And Sarah Kent.
Good morning. Sarah Kent, Human Services Planner with MAG, is here.
Thank you. And Brandy Mead.
Hi, good morning, everybody. This is Brandy Mead, Human Services Director at MAG.
Good morning. And Julie Montoya.
Good morning, everyone. Julie Montoya, Human Services Planner with MAG.
Morning, Julie. And Tina Lopez.
Good morning, everyone. This is Tina. I'm the Administrative Assistant for the Human Services Division. Welcome.
Welcome. And Amy St. Peter.
Hello, Amy St. Peter, the Deputy Executive Director with MAG. Thank you for having me here today.
Hey, Amy, thanks for joining us. Is there anybody else on the call that would like to introduce themselves?
This is Ty Rosensteel with Crisis Response Network. Sorry, I wasn't responsive to the first time around.
Hi, Ty.
Michelle, I also see Trisha and Jen Page on there, even though they didn't introduce themselves. They might be on the call.
Oh, okay. Trisha Gibson. Okay. And
I see Craig Tripton in now too. So.
Okay, and Jennifer Page.
She just responded in the chat that she's here.
Oh, okay. Thank you.
Oh, Trisha too.
Okay, they're here. Okay, we got you guys. We have you. Okay. And who else did you say? And Ty.
Craig.
Craig.
Good morning. Can you hear me now? Yeah.
Yes.
Oh, okay. This is Jennifer from Mercy Care.
Okay. Yes, we do hear you, Jennifer.
All right, great. Thank you.
And Craig Tripkin, are you on? All right. So for all participants going forward, please mute your phone on the computer or your phone when you're not speaking. And please do not put your phone on hold. Otherwise, I believe we get the music or the beep. For all participants, we ask that you please identify yourself when speaking. And we will be reminding people to do this throughout the meeting, as we have been advised that this is important for the open meeting law. One final housekeeping item, all votes will be roll call votes, and Stephanie or I will do the roll call after the motion is made. So we will now move on to Stephanie for a call to the audience.
Thank you, Michelle. Please note that members of the public were given an opportunity to submit written comments relating to this meeting to azmag.gov/comment within 1 hour of the posted start time for the meeting. Any written comments submitted will be included in the meeting record. Were there any comments posted, Steve?
No comments were posted.
All right, thank you. And we will now move on to Michelle for approval of the October minutes.
Okay, so thank you. We want to do the approval of the October 14th, 2020 Maricopa Regional Care Committee meeting minutes. please refer to the enclosed materials. So I will just give everybody a chance to look through the materials real quick. Are there any comments from the committee on the minutes? Okay, do I have a motion to approve the minutes?
Hi, this is Stephanie, HSC. I make a motion to approve the minutes.
Hi, Rosensteel, CRN. I second.
Okay,
And
thank you.
I'm sorry, this is Wendy Johnson from Justice Center, and Ann Johnston was credited with my comments, and if she doesn't want to be credited with those, we probably need to change the Johnson listed as the agitator in the minutes.
Good catch. Thank you, Wendy. Okay.
Community Bridges.
We'll make
Thank you,
that.
Wendy.
Okay, with those approvals, do I need to get can I go forward, or do I need to get a first again? Approval again?
I think if the person who motioned and seconded agreed to that amendment, then we can proceed that way.
This is Stephanie, HSC. I agree to the amendment.
Okay.
Hi with CRN. I agree to the amendment as well.
Okay. So I will proceed with the roll call. All right. Stephanie Smith. What did I say?
Aye.
Okay. Adrian Clark. I don't know if Adrian was on. No. Okay. Stephanie Crum.
Aye.
Kathy Denofe.
Aye.
Alfred Edwards.
Aye.
Dolores Ernst.
Aye.
Trisha Gibson.
She says aye in the chat.
Okay, thank you. Wendy Johnston.
Aye.
Anne Marie Johnston.
Aye.
Laura Magruder.
Aye.
Jennifer Page. She may do it in the page. Aaron Rain.
Aye.
Nikki Ramirez.
Aye.
Tama Reily.
Aye.
Ty Rosensteel.
Aye.
Chela Schuster.
Aye.
Sarah Sims. Oh, I don't believe Sarah's on, but Laura Scott Nicky.
Aye.
And Stephen Stivers.
Aye.
And Joanne Thornton, who wasn't on earlier, just wanted to give him a, oh. And Craig Tripkin. Oh, okay. All right, so motion passes. Thank you. We will now go to Stephanie for the next item on the agenda.
Thanks, Michelle. Next, Brady Mead, the MAG Human Services Director, will give an overview on the planned provider forum on regional best practice strategies and lead a discussion for input on this.
Hi, good morning, Madam Co-Chairs and members of the committee. Once again, it's a pleasure to be here with you this morning. Really appreciate the opportunity to talk to you. As you know, homelessness is increasing and there is an impending wave of evictions that are on the horizon, sadly. We're really looking at this in a sense of urgency in terms of addressing homelessness, coming up with solutions that we can implement across the region, addressing homelessness in a more coordinated way throughout the region. So we really want to hear from members of the community, from the Continuum of Care Committee, about how we move forward with your input and with your voices being heard throughout that process. So toward that end, we are holding a series of listening sessions We're going to be engaging with multiple groups. The first of those groups will be with the nonprofit providers. It really is important that we hear from nonprofit providers that your voices are part of developing the solutions. We will be holding other listening sessions with a variety of other stakeholders as well, including but not limited to business community, philanthropic community, faith-based community, hearing from municipalities, healthcare community, and ensuring that we have those with lived experience informing the solutions along the way. So wanting to reach out to the committee today and hope that you'll help us to frame the first listening session, which will be with the nonprofit providers, with CEOs from nonprofit providers. We'll be holding a second listening session with nonprofit providers, which is more with frontline staff. So also wanting to hear from frontline staff as well. Our first provider forum with the CEOs will be January 6th, and I believe an invitation went out just this morning for that. January 6th at 10 a.m. It'll take place over Zoom. And will be facilitated by Eric Cole with ASU, who's also on the Continuum of Care board. So he'll be facilitating that listening session. So really today, wanting to hear from you about getting your voices and shaping that forum. So wanting to know, what questions should we be asking? What type of information should we be seeking from CEOs as we hold that listening session? We're hoping to hear about needs and challenges that CEOs of nonprofits are facing, what data they need to help demonstrate those needs, how can we help with that, and also learn about possible strategies, promising practices that are working within the region, or strategies that CEOs are aware of or wanting to delve into and they would like more information about. So wanting to hear from committee members today about how would you like us to shape that session that's being held on January 6th, and then those sessions moving forward with the other stakeholders as well. So I'll pause, and Amy St. Peter is on the call as well. Amy, if you want to add to that, please feel free to add to my explanation of the listening sessions, and then really want to open it up to dialogue and hearing from committee members about your suggestions and recommendations for those listening sessions. Amy, is there anything that you would like to add?
No, thanks, Brandy. Great job. Just really the goal is to listen. It's really to hear about your concerns, your challenges. What do you think can be most relevant at that regional level? So we'd love to get your feedback today. We'll be circling back with you with the results to make sure that we're understanding the findings and that we're really meaningfully integrating the findings and the results into the development of those regional strategies. So really appreciate any feedback or questions that you might have. Thank you.
Thank you for that, Amy. So really at this time, want to open it up to you. So hearing from you, maybe let's start with what are your suggestions in hearing that we're hosting these series of listening sessions? What type of information would you like us to seek during these listening sessions?
Good morning, everybody. This is DC Ernst. Just a quick question, Brandy. In the groups that you're planning on talking to, do you include first responders at all in that, from firefighters and police perspective?
I think that's a great suggestion. First responders is certainly an area that we can add to the list. I don't know that that was identified initially, but I think that's a great suggestion, DC.
Thank you.
Thank you. And that's exactly the type of feedback that we're looking for today. Making sure that we are covering, all of the different sectors that we need to be reaching out to. And then in those listening sessions that we are pulling the information that's really, we should be pulling from the individuals that are attending those sessions. So first responders is a great addition to that list.
This is Stephanie from NAC. Just a reminder for everybody to identify themselves when they begin speaking. And quick question, Brandy. Well, yeah, a question. just to make sure that everybody's aware, could you, when you talk about regional, would you be able to remind everybody when we say regional, what that means?
Yes, so we're talking about, in terms of the region, we're talking about really cities and towns within Maricopa County region. So within the MAG region, which encompasses the county.
And that also includes portions of Pinell County. We understand that Pinell County is covered by a different continuum of care.
Right.
This is a full regional plan to end homelessness. So it'd be all of Maricopa County, which includes the cities, the towns, the 2 counties, portions of Pinell, and the Native Nations. Thank you.
Yes, thank you, Amy.
This is Wendy Johnson from Justa. I'm curious if groups like Family Promise, I Help, those that are doing pop-up shelters will be included in these conversations.
Another great suggestion, and reaching out to the faith-based community is one of the sectors that we had thought to bring into the discussion. So I think those organizations that you mentioned would absolutely be included within faith-based. Thank you.
This is Chela Schuster from Community Solutions, and I just had a question about like the makeup of the groups, or just maybe a suggestion or a thought. And I don't know how this would work, and you might already be well on your way, but I just want to put this out there too. I think it's great to have the CEOs of the organization.
I'm having a hard time hearing you.
Okay.
I'm not sure if others are.
I think it's great to have the CEOs of the organizations participate. Can you hear me now? Okay, so yes. I was wondering though, if there's potential, sorry, if there's an opportunity, these are silly, I know, I'm sorry. If there's an opportunity to look at having other folks from organizations besides just CEOs, especially maybe people that are closer to the work. And I get like they have to understand the more regional implications and see the bigger picture, but I still think that there's a lot of value in having some of the folks closer to the work being able to participate in some of these conversations, in addition to the people that are like probably making some of those decisions. I think it's also part of like the race equity work and like the kind of changing of the way we look at things, having people closer to the work and closer to experiencing homelessness and closer to, you know, the front lines, being able to share their information and thoughts.
Yes, Shayla, I think, again, another important point that you're raising, and the first session is sort of targeted toward the CEOs, senior leadership, but we are planning another another session with nonprofits where we're wanting to engage with more of the frontline staff and hearing from their perspectives as well. So that is on the horizon. That is something that we'll be planning. And so that second listening session, the date hasn't been set yet, but we are looking at toward the end of January for that second listening session with more of the frontline staff among those nonprofits. And you know, as we're looking for strategies, we're really wanting to look through that racial equity lens and ensuring that we are considering that, and we're always looking through that racial equity lens through all of this work. So that is something that is really important to the team. Also ensuring that we're getting input from those with lived experience is very important. So, you know, that's an area that I would love to hear from all of you today. And, you know, what are your suggestions on how do we do that? How do we ensure that we are hearing voices from those with lived experience and they're helping to shape the regional strategies that are developed as a result of these listening sessions?
One question I think that would be important to ask, and maybe we're the only ones experiencing this, would be a challenge is getting contracts, signed contracts. So we're doing work, we're paying for work to be done and have no signed contracts.
Laura, you're referring to the fact that the NOFA has not come out in your?
No, I'm not even referring to that one at this point. I'm referring to various municipalities for CDBG and ESG contracts that have been awarded. We've been asked to do the work. The work's been going on and we still have no signed contract to actually get paid.
Okay, thank you. Thank you for bringing that.
Since you brought up HUD, that's another one that's looming.
Right. yes,
We have
that's
no
one
idea
on our
what's
minds
happening
as
with
well.
that.
Thank you. We do have a question. Where does the City of Phoenix's plan to end homelessness fit into these discussions? Really, really critical. We're moving forward right now on two paths. One is to collect some information about the most effective practices in addressing homelessness from a regional effort. And so that work is underway right now through Homebase. They're also helping us to inventory all of the local strategies. So that's where the City of Phoenix plan would come into play. And we're creating an inventory of all the local strategies that are already in place, and then analyzing those for the ones that might have the most or the best viability for regional implementation. So building on the local work as well as looking nationally to make sure that we're really learning from national counterparts as well, particularly those from peer regions to ours.
This is Stephanie with NEC. I have 4 things. First, I want to make sure that our tribal communities are not forgotten about and are represented and included in this plan for both being on the tribal communities and also the tribal members that come into the urban areas for services. 2, where elected officials come into this. I know that's opening a bigger can of worms. There's lots of different elected officials in lots of different capacities, but I think some of them that can be change makers should be at the table or involved in this. And to piggyback onto that, I'd like to know what different areas or cities are doing to address the affordable housing crisis and, developing more affordable housing as our rents continue to increase and become more unaffordable for more people. And my 4th one is involvement in other systems, such as the criminal justice system, aging out of foster care. We know a lot of folks that experience chronic homelessness, homelessness plus chronic homelessness, they are involved in other systems as well.
Well, and to add on to
4
Stephanie,
for now.
well, and this is Laura again, to add on to Stephanie, also Department of Child Safety. I know there's a lot of family unification project vouchers in the community, and we've had no success in getting any of our families to be able to advocate on their behalf with DCS to get those utilized and out on the streets.
Thank you for those comments. And I think those issues that you raised there at the end are certainly challenges that we're wanting to hear about. So those can help inform, how we move forward and address homelessness in a more comprehensive way. So that's exactly the type of feedback that we're looking for around challenges. The comments around ensuring that tribal communities are included, I think that's very important and needs to be part of this outreach as well. We are certainly planning to reach out and have been reaching out with elected officials and ensuring that their voices are being heard as well. And we've heard from elected officials through Amy and Sarah have presented recently to the MAG Management Committee and the MAG Regional Council, and elected officials are seeing this as a very important issue that needs to be addressed. They are certainly wanting to be, they see this as an urgent matter and are really wanting to address homelessness with a sense of urgency and developing short action steps with short time frame so that we can get something in place, have some wins, have impact across the region in addressing homelessness. So elected officials are certainly going to be involved throughout this process as well. And addressing the affordable housing crisis, another point that was made, Stephanie, yes, we're hearing that as well. We need to look at what strategies are in place now and how we can build upon those strategies and expand them across the region, especially because of the eviction moratorium being lifted and just the possibility that that will result in more people becoming homeless because of that. So affordable housing needs to be addressed. Absolutely agree with you.
This is Michelle Jamison with US Vets, and when you talked about the eviction moratorium, that's a concern as well. We're going to have a lot of new people entering first-time homeless and things like this. And so what's the community plan? How are we going to address the influx of people that are going to be experiencing homelessness?
Great, thank you.
This is Wendy Johnson from Justice Center again. Not to poke the tiger, but I've seen a number of plans to end homelessness from the city of Phoenix, as well as Mesa, Tempe, Scottsdale, all these announcements. Are we coordinating with folks at the level that are making those plans to have them participate in this? Because I don't want to see us waste valuable time doing something that would be better off done together. Or in isolation. I mean, you know, we have to make those calls. So that's my last comment.
Thank you for that comment. And we're absolutely moving forward with coordination among the cities and towns. We've been in close coordination with the city of Phoenix. And as Amy mentioned before, we're pulling together the existing plans that cities and towns have developed, that have been developed by the county, the state, the Continuum of Cares regional plan. So pulling all of those together and looking at the strategies that are the commonalities and the strategies among all of those plans. How we can better coordinate within the strategies in all of those plans. And then what are other strategies and action items that we need to implement that may not be in those plans that we're wanting to hear from you and hear about during these listening sessions, things that maybe we haven't thought of, or ways that we can work more cohesively together as a region. So yes, we are wanting to involve the cities and towns, and I know they want to be at the table as well. And our this is an important issue for them as well. And you know, we've heard from many cities and towns that they want to be at the table. They want to be addressing homelessness, and they want to be with us in developing solutions.
Thank you. And just one more item on that. We are working with Maricopa County to pull together the human services directors from the cities and towns, and then of course including the county, to just to make sure that we're really aligned and that we're learning from those local experiences. The best regional plans are ones that are deeply rooted in the priorities of the local communities, and so we'll have that really as a cornerstone of these efforts. And keep the comments coming, Wendy. They're good.
This is DC Ernst again. Brandy, are you reaching out to the other crisis response programs within the county? And if not, do you need a list of contacts? Because I'd be happy to share that with you.
I would love your list of contacts, DC. I think that it would be great. You mentioned the first responders as well. I think, you know, ensuring that crisis responders are also involved. Because
we're talking about longer term solutions, and from my perspective, and I think from the crisis response perspective, is what are we developing for that immediate crisis, that when our units come in contact with someone who is either chronically homeless or who is, because of being evicted, is facing it for the first time, what are our resources? So transitional housing is an awesome idea, but we also need some services for that immediate need, because I can tell you that from our experience, we leave families, sometimes with kids, in their cars because we don't have any options for them in the middle of the night when they have tried everything during the day, and then it gets cold at night or hot, and they call 911 just seeking services. So those are the concerns I have as well. So thank you.
Great, thank you. Very important concerns that you raised there, and I would love to ensure that we have fully incorporated the list of contacts that you have for those crisis responders. Thank you.
Brandy, quick question. This is Laura Scott Negate. Are you, I know Sarah Sims is not on this morning's meeting, but are you also including the Department of Education's homeless liaisons in this conversation? Although they're not CEOs, I mean,
Yeah.
they're have a very different perspective than a lot of the nonprofit providers.
Thank you for that, Laura. We had not thought of the homeless liaisons, at least I hadn't, as we were putting together our stakeholder list. So another great suggestion. Thank you.
We do have an education forum planned, and so I think it'd be great to include them in that. We do have 2 questions in the chat. Will there be opportunities for more funding tied to this plan? We do have a form that will be developed for the philanthropic community, and we'll be working with other funding sources as well. We have a chart that should be done actually by tomorrow that lays out all the different funding sources along with their eligibility, so that we can better understand kind of the full array of resources that might be available to support these strategies. Also, another question, how do you envision the committee and other work groups being incorporated and utilized? Brandon, you want to talk a little bit about that in terms of the integration into the forums and then circling back?
Sure. So just ensuring that our invites are going out to members of the work groups. So members of our existing work groups will have an opportunity to participate in forums. And then we can also have this same type of discussion during our work group meetings as well, to ensure that we are getting input and feedback from the membership of the work groups. Because we do want to ensure that we are incorporating their input as well. So there will be multiple ways for committee members and work group members to participate in these various listening sessions, and then can have these conversations during those meetings as well.
This is Ty Rosensteel at Crisis Response Network. I first just want to applaud this effort. I really appreciate the thoroughness of gathering stakeholders through this approach. I would like to say that for the CEO Nonprofit Forum, I think that there's 2 really important aspects to consider. The first is that our executive leaders do have great expertise in being able to give feedback to the systems and to the approaches of the region. And I hear that as being one of the key items to be able to collect from this provider group. What I would encourage is also trying to engage that community in conversation around what the providers need to be effective in implementing the strategies. So if there is a strategy about ending homelessness that needs to get implemented, it's going to be our nonprofit partners that are going to be delivering those services, and making sure that there is adequate conversation to identify what the nonprofit providers would need to be able to implement that. Is there sufficient administrative staff, sufficient data analysis going on at the organizations? Is there sufficient frontline staff? What are the needs that actually exist within the organizations? I think that it could be really easy to focus exclusively on just the regional conversation and the regional strategy, with potentially missing that opportunity to collect from the CEOs themselves what they need to implement the work.
I think that's a great point, Ty. Thank you for raising that. We want to ensure that the strategies that are developed are sustainable and can be implemented. So I think you raise a very important point. Are there other suggestions around questions that we should be asking or focus for these sessions?
Brandy, it's Laura again. How is wildfire and the CAP agencies being brought into the conversation?
Another good point. So certainly we need to include the CAP agencies. They're an important piece of the continuum. So looking at the different areas, I think around they could be brought in, I think, in several of these different categories, but certainly around municipalities and getting input for how municipalities are addressing homelessness. I know CAP agencies provide a very important resource in the community, and we need to include them as well. So it was the CAP agencies, and then what was the other group that you mentioned, Laura?
Wildfire.
Oh, wildfire. Okay, yes, wildfire, another very important voice as well.
And then I appreciate Eric Cole with ASU, but I'm wondering if Maricopa County Community Colleges is also going to be brought to the table. We do experience a lot of community college members who are also homeless or experience housing instability.
Yes, and I think in the education forum, certainly Maricopa Community College, that's another good suggestion. Amy, I think you were wanting to add something.
Thank you, Brandy. Laura, wildfire and the community action programs, we do have a service forums that we'll be scheduling, and so they would absolutely be invited to that one.
Thank you.
Thank you.
Any other input? This is great. Thank you so much. Keep it coming. This is so helpful to us as we shape these forums.
Brandy,
Hi,
this is
Daniel
Michelle.
Davis.
Oh, sorry. Go ahead, Daniel.
Daniel Davis over at UMOM. There's been a lot of really good ideas that I also want to second from coordination of funds, because we're hearing a lot of funds are going unused, especially like this is going to be January 6th, but a lot of CRF funding is going unused before December, and municipalities are trying to find what to do with it, but we do have some big funding needs for the providers. So ask maybe what those needs are, and not just base it in a municipality, but do the region-wide coordination. Also, when Laura talks about affordable housing, or Stephanie brought up affordable housing also, we're having a hard time with accessing affordable housing, landlords raising their tenant screening criteria. I know a lot of you have heard me make a stink about this in other conversations, but even our affordable housing, our families who used to qualify for it before COVID are not qualifying for it. So we really have to engage landlords across the region. I would also add, based on Laura's comment of contracts, we're having a lot of funders, verbally saying that they're okay with, providers not meeting their goals during COVID because of all the issues going on. But from a provider perspective, there's a lot of exposure there. If we're just working as hard as we can, but we're still nervous, we may not meet our goals by the end of June. What does that look like? Like, we appreciate the verbal support, but our CEOs and our board don't do well with that. The final thing would be, obviously, like, COVID is in a different spot than it was. We're talking a lot about vaccines. Are we part of the 1B first responders piece? A lot of us are assuming that we are, but our staff are very nervous. Our staff are very, very worn out, and they just need solid answers on that. So a question to CEOs as to, like, what do you need from the region, from the health department, from different leaders for what our COVID plan is, and what support can we expect? Thank you.
Great. Thank you for those comments. Very important.
And there was a question in the chat, how will the general community be notified of the forum so they can provide input? We could schedule a separate forum for the general community. We really want to make sure that with these forums that we keep them to sizes that are inclusive, but also small enough so that we can hear everybody's voice. So we're not necessarily posting this meeting schedule for the forums, out to the general public as an invitation for everybody to attend. If there's a desire to hear from the general community, then we can absolutely schedule a forum that's really targeted to the general community and to engage them in an appropriate way. Thank you.
This is Stephanie from NEC. Go ahead, Laura.
Oh, I'm sorry, Stephanie. Just to piggyback a little bit on Daniel too, and also the conversation of affordable housing, I think it'd be important to get the Multi-Housing Association to one of these forums. I mean, I think that all the money that's come in on the rental side is great. However, there has not been a whole lot of support on the landlord side. And I think that's why many of them are tightening their tenant selection criteria. And I don't blame them on that side, because they need to be paying their mortgages as well. So they really need to be at the table in some of these conversations.
Thank you, Laura. That's a great idea. We do have a forum that's currently being planned with the developers, the lenders, and the realtors. We can certainly extend that to include the Multi-Housing Association as well. Thank you.
This is Stephanie. Thinking specifically about elected officials, it's great that some of them are aware of this and are supportive of us, but I want to know, what are they going to do? Like, I want to hear some action words in their sentences, that they are going to co-sponsor bills, that they are going to try to change, anything from a city ordinance to the state level. What are they going to do to help this? Yeah, like, the talk is great, but we need to see some action from them. And I personally, I can't speak for everybody here, but personally, I want to know who's saying what. It's kind of hard to keep up with everything in that world, but who's supportive of that? That way we can have people write to representatives in support or in opposition of different things that they're working on to get that political will from them. We really, really need political will, especially when it comes to the development of affordable housing and the continuous rent increases that we're seeing.
Mm-hmm. Absolutely. Great point, Stephanie. If you haven't already had the opportunity to do so, I really recommend going and listening or viewing the last meeting of the MAG Regional Council. Tremendous support from the elected officials and really talking about what they want to do in this space. We will be circling back with them with that list of action steps with those strategies. And we'll be cycling through Management Committee as well as Regional Council, in addition to the Continuum of Care Committee and Board with those strategies, and then asking for approval. And ultimately, we'll be getting down to who's doing what by when. So there's a lot of appetite throughout the region at all levels right now for action. So I think that's very much a shared goal right now.
Daniel Davis at UMOM. One last thing. I don't know if this would be an appropriate question for that audience, but I was a part of that eviction summit for the Tempe City Council, and one thing that kept coming up was all of our systems are already overwhelmed, and we're about to hit it all with a tsunami. We have really incredible providers in our community. I don't know if I could say that as a provider, but I think we would all agree. And great first responders, and I just think the system is full of really capable people, but we don't stand a chance against an eviction wave like that. And not only that, but when we look at what's going to happen with an overrun judicial system, an overrun first responders and health system, before they even get to the homeless system, it looks pretty bleak. I wonder if some of the data support that we could have from ASU or from even MAG maybe, but is the cost effectiveness of just keeping people housed. The amount of trauma that we would prevent aside, it just makes way more sense from a funding standpoint. And what would that look like? I know that's something that we toyed with in that summit, but again, it's kind of like talking about how do we move somebody out who's getting evicted, but with all those funds, it's just cheaper to pay off somebody's rent. I think that should be part of that conversation with those CEOs.
Thank you. That's a great point around, what data do we need? And I think looking at cost studies like that and the cost of not addressing homelessness versus the cost of acting and keeping someone housed, showing those differences can be a very important tool. Thank you. Any other comments or feedback, suggestions? I haven't heard discussion around involving those with lived experience. That's something that I know is important to our team here at MAG. Do you have thoughts or ideas around that?
Hi, Brandy. This is Michelle. One of the things I think if we can go on, if we want to just end that, because the agenda number 5 is talking about the lived experience. So everybody's okay if we just end that discussion to go on with, because in our October committee, we briefly discussed the value of involving people with lived experience in the COC activities. So it was suggested that this topic be addressed at this meeting. So I guess now is just a time to open that up for discussion on how to incorporate people with lived experience into our COC and community activities.
This is Stephanie from NEC. Maybe a forum on campus at a shelter. You have direct access to people currently experiencing homelessness that I'm sure would be more than happy to give you some input. Or people in some of our big housing programs, I'm sure would be willing to participate as well.
Well, and I know that the last time this is Laura with Save the Family, the last time that we did this, we did exactly that, Stephanie. And I mean, we have to bring the focus groups to the clients, not expect the clients to come to us.
We also need to pay people. And I think like real payments, like figuring out how to pay them cash, using Cash App or something like that, not just gift cards, like incentivize people in a real way if they're going to have their time to do this. It's really important work and they need to be compensated appropriately. And I know that can be difficult, but I think we need to figure out how to have funds for that. And I think that's important for focus groups, but also just in general, I think we need to look for ways to fund having people with lived experience. Because I think that's been some of our issue in the past. Like I remember, we would have like, kind of token, we'd have focus groups and we'd have token like gift cards and things like that, like for Subway or something like that. And that's not what people want and that's not what people need. And so I think trying to figure out how to really compensate them. And I think in addition to that, because I know we're talking about the focus groups, but also other things like figuring out, and I think there are definitely great examples of this, and there are plenty of people in this call and in this room, but like having opportunities to hire people with lived experience in our community and really giving them a voice, and figuring out how we can do a better job as organizations of training people and supporting them, like not just as staff, but like if people are going to be participating in like system level discussions, making sure that they understand a lot of the points. I think people are able to learn quickly and will be able to have these conversations. They just need to be prepared and equipped to do it. And that doesn't mean that you don't include other system level staff or people that have more knowledge, but really empowering people and providing education and support to them, I think is really key as well.
Hi, this is Stephanie at HSC. I just wanted to say too that I feel like we have quite a bit of untapped resource for the people with lived experience. I mean, many frontline staff at HSC have experienced homelessness, myself included. But I feel like the higher you go up the chain, the less and less we have people with lived experience. So I don't know if there's a way to open up more opportunity for frontline staff or people who have experienced this to have more of a voice at a higher level.
I like the idea of bringing the forums to the people that are currently experiencing homelessness or that have the lived experience. And so maybe we open it up for different agencies to do forums and then bring that back as a discussion. And then the other thing is, even on our committee, I know that there's a seat for someone with lived experience, but one of the things is we want to make sure that the lived experience is recent versus 10, 15 years ago, because they'll have more recent experience than in the past.
Yeah, that makes sense, exactly.
Madam Chairwoman. Hi, this is Sarah Kent. One thing I just wanted to share, and Julie will touch on this in more depth, is with the racial equity consultant work that we're doing right now. I am part of the action plan around lived experience with Danielle Nieto from Native American Connections, amazing person. It's her and I, as well as Donald Whitehead. And we're just brainstorming various ideas that we're also, hoping to share with all of you because your ideas are so great. But a couple of things that we're considering is that it would be really helpful for us to ask folks with lived experience how they want to participate. So we're thinking of, maybe a survey monkey or something like that. Just, because I think as a provider, as I have been, I think a lot of times we assume, of course they want to be in decision-making roles. Of course they want to do this. But I think a survey type, as well as some of the forums you're talking about could really help, us to understand better about how folks want to participate. I absolutely agree. The incentive piece is something that we're working on right now with Donald Whitehead, the consultant, because we know, we're a HUD funded situation. We as the COC are not able to incentivize, but we're looking at lots of other examples of communities that are using incentives in various ways, whether it's a partnership from somebody else or, so that is definitely huge to us. And then we're, kind of brainstorming around, do we want to have an advisory board with folks with lived experience that's somehow woven into the racial equity work? And then they can then, every single board meeting, every single committee meeting, have a standing agenda item. These are the things we're working on. This is the oversight. And there's just so many cool things that we can do and that we're brainstorming in this racial equity action plan. Of course, when we talk about incorporating folks with lived experience at every single level of decision making with a racial equity lens. So your input right now, and if you think of something after the meeting, please shoot it my way over to Steve, whoever, because your input is so important. And this is very important to me as well. And being part of the action plan for racial equity work, is something that we definitely need your feedback for. So I just wanted to share that piece.
Thank you, Sarah. And I'd just like to remind everybody when they speak to please introduce themselves and say their name just for the open meeting law. So thank you. No, not just you.
Madam Chairman?
Sorry. Okay.
Okay, Nikki Ramirez.
That actually wasn't me that spoke first. I was going to wait. I don't know who chimed in.
Oh, okay.
Julie.
I'm not sure.
Go ahead, Nikki.
So Nikki Ramirez with Chicanos por la Causa. I had just wanted to mention that, currently we are in partnership with CSH, and we are going to deploy their Speak Up model here with a pilot of our clients. And so I believe we're doing 12 to 18 clients over a 12-month period. And for those who don't know what the Speak Up program is it's supposed to help those with lived experience to develop their storytelling skills or help them understand what different processes they can become engaged in so that they can advocate for change with legislative officials or just within the community and help tell their stories. So we're going to be working with them for the next 12 months. And what we're trying to do internally within our organization is we have several advisory boards. We have our actual big board. We have a couple of different lines of business within our organization, and we do have seats available for those that are community members or with lived experience. And what we would also like to do is if there are ways that we can advocate for anybody who is a graduate of that program to have an opportunity to join in and share their story with other groups such as the COC or any other work groups that we have. If there's a way that we could partner, we would be happy to do that. And this is something that we're not just thinking of doing as a one-time thing. This is something that we hope to keep going and annually have a new group of people that is put through this institute.
Thank you.
Madam Chairman, this is Julie Montoya with MAG. May I share something?
Yes.
So I just wanted, just to piggyback off Sarah Kent's response. We are going to be doing some learning tracks, and one of the learning tracks with our racial equity work is for people with lived experience. And so, it's exciting to hear, Stephanie talk about frontline staff. I think that, if you have particular people in mind, that this would be a good opportunity for them to, learn about the planning and systems work and giving them some opportunities to also, learn about the acronyms of the homeless programs and how the systems work and all of that. And and also Nikki with the Speak Up program. I think that, you know, I'd like to talk to you a little bit more about that. I think that that might also be a good opportunity to work together.
Hi, this is Michelle Jameson. These really great points. And so one of my thoughts is I want to be able to put this into an action step. And I don't know if that's where we get another ad hoc group to do this. So because I want to take the ideas that we have and to put into an action plan. So I guess I'm open for suggestions on how that would look.
Madam Chairman, this is Julie Montoya again. I think at least as far as the racial equity work, you know, like Sarah mentioned, you know, she's kind of working with Danielle Nieto and putting together an action plan. So I would say reach out to Sarah and Danielle and see about participating in some of those actionable plan meetings.
Madam Chairwoman, if I might add.
Yes.
Sarah Kent with MAG here. Yeah, absolutely. Please send me any information that you have or that you can think of. And next week, the consultant, Julie, Steve, and I, as well as Danielle, we are meeting to just kind of bring all the ideas out there on the table. This is what we heard from the board. This is what we heard from the committee. And of course that, you know, because we are looking to revamp our work groups anyway after the first of the year. So if we do, you know, with everyone's guidance, if we do decide to have a lived experience work group or committee or something like that, that wouldn't happen until after the first of the year. But we would love as much, you know, insight or suggestions as you can provide, and that would be great. So I can put my email in the chat for everybody. You can email me. That'd be great. Thank you so much.
All right, thank you. All right, does anybody have any additional comments that they would like for the committee? Okay. So I guess just to any information going forward, just send to Sarah, and then they're going to be reconvening and then put an action plan together for the first of the year. Is that correct? Okay, perfect. So thank you. Now Stephanie will introduce the next agenda item.
Next, Sarah Kent from MAG will provide an update on what is planned for the 2021 point in time homeless count, as HUD granted a waiver to opt out of the street portion of the point in time homeless count.
Great. Thank you, Madam Co-Chairs and members of Maricopa Regional Continuum of Care Committee. As mentioned before, I'm Sarah Kent, Human Services Planner with MAG and the Regional COC. So here to just provide a little more in-depth detail on 2021 point in time count. So based on feedback that we have received from the majority of the PIT municipality coordinators and homeless outreach teams, with the fact that COVID-19 cases are still very much increasing, unfortunately, in our region, even today, and the health and safety concerns among volunteers and staff being a huge risk and liability to our whole continuum of care. Based on guidance we have received from HUD, and given that we have very comprehensive data in-house that we use regularly, that we can share with HUD, we have been approved by HUD to opt out of the unsheltered point in time count for 2021. We're still able to do the housing inventory chart and shelter count, thanks to Ty's awesome team over there at CRN HMIS, as they can pull that data. So for the few municipalities that want to conduct the count on their own, please know that the data will be for their use only, city planning, etc., and not submitted to HUD, because the PIT count report in HDX is regional in nature and not broken down by municipality. We've also virtually met with a large number of COCs around the nation, and it's clear that most COCs are very uncomfortable putting staff and volunteers at risk of COVID-19. What we've learned is that the majority of COCs are either opting out this year entirely, and that means not doing the point in time observation or the unsheltered or the sheltered or the housing inventory chart, opting out of the whole thing. And HUD has also mentioned that they, for the folks, for the COCs who have asked to opt out, they have not denied anyone. They have said, yes, you can opt out to everyone, every COC that is asked at this point. And there will, for those COCs who are opting out, they'll either do the full or the partial and use their existing data that they also have in-house. So we are one of the luckiest COCs in the nation, I'm finding, because we have great data that we can use. And there are a lot of COCs that really don't have what we have. So it's making me feel more and more grateful every time I meet with the other COCs. The municipalities that would still like to do a full interview and observation tool are Tempe, Scottsdale, Litchfield Park, and Chandler as of now. The observation tool will be done by Avondale, Surprise, and maybe Gilbert. The municipalities have also let me know that this is not set in stone, that we know with COVID increasing that, you know, they might pull out last minute, which that's okay. The only reason why I have reached out to the municipal coordinators to say, if you are going to be doing a pick count, provide me with the date and time frame, it's because the VA, if you remember from years past, there's a question around veterans there. And so we want to make sure that the VA is well aware of those municipalities that still might do the full, just so they can be on standby for that veteran question and receive services in that way. So we're definitely looking out for our veterans there. For those municipalities that are still going to be doing the count of some sort, I'm able to help with virtual trainings to go over the questions and help with outreach safety protocol training. We will not be having an app this year as the COC has opted out. But I did provide the few municipalities with HUD's paper interview and observation tools that the municipalities can edit to fit their needs within their area. So, you know, just reiterating that the health and safety of those experiencing homelessness, the staff, and the almost 1,000 volunteers it would take to do the pick count during this pandemic is our biggest concern. So that is why we made the decision that we did. And please let me know if you have any questions. I have one
Thank
question.
you, Sarah.
Sorry, Nikki Ramirez with
Sorry, go ahead.
I just have a question as far as the data that we do have access to. If we're not doing an unsheltered count, what will that data look like when we put out the point in time count information next year?
So because we've gotten approval to opt out, we do not have to put out any point in time information next year. We've opted out of the 2021. And so, you know, for various, you know, if we were presenting to the regional council or something like that, we've got, you know, we wouldn't say it's point in time data because we've been approved to opt out, but we do have an outreach viewer where outreach teams are putting their XY coordinates into HMIS so we can see in real time where clients are. And so it's really nice for those who do have outreach teams to be able to coordinate care in that way. We've also got a weekly shelter report that we receive data from HMIS that goes over a large slew of questions around, you know, basically the universal data elements, you know, what is your reason for homelessness this time? What are your demographics? Those sorts of things. And so a lot of what the pick count covers is what we gather on a regular basis that you, Nikki, as well, if you wanted to get a snapshot, or can you give me the data, Sarah, from this month to this month of all the outreach encounters, we could definitely help with that because we don't give any information that you know, such as name or things like that. So I hope I answered your question okay, but we do not need to submit any data to HUD for 2021 aside from the shelter data and the housing inventory chart data. Everything else HUD said totally fine, and they will not penalize us whatsoever on the NOFA or anything at all, because that of course is a concern of some COCs. Please don't penalize us, if, you know, and they said, we promise we won't. So I hope I answered your question okay.
Yes, I think I would just have one follow-up question to that, and it would be, is there any downside or risks or concerns around not having that portion of the data next year? How does that affect planning? How does that, is there just a domino effect from not having that we need to discuss as a committee, or that we should be discussing within the forums?
According to HUD, they already know that the data for the 2021 PIT is going to be really an undercount. They already know that. You know, and I think some municipalities say, oh, but the eviction moratorium is coming up. We want to know that information. So to answer your question, according to HUD and from our perspective, there is no downside because we do have such comprehensive data in-house. For those COCs that don't have as comprehensive data ongoing as us, they're in a little bit of a different predicament. And as far as planning, they might have some concerns about how they're going to get up again. But our data that we collect in-house shows more of a true picture of homelessness in our region that HUD's actually pretty impressed by, because that was one of the things that I had to send to HUD is, you know, when we first decided that we were going to opt out, I had to tell them in great detail, this is the other data that we collect and this is how we use it. And William Snow, who is like the HUD guy, he was quite impressed. He said, wow, that, you know, that really, I'm sure that your in-house numbers are more true than PIT itself. And I agreed. I said, yes, sir, they are. So I think we're going to be, we as a COC are going to be just fine. But as the whole nation, that's a different conversation.
Thank you.
Does that help, Nikki?
Yes.
Okay, perfect. Thank you. Be happy to answer any other questions. And if you think of anything after the meeting, please email me. I'd be happy to help.
All right, no other questions for Sarah. We will move on to the next agenda item. Michelle?
All right, so we're going to talk about the racial equity update. And so Julie Montoya from MAG will update us on the racial equity work and with the consultants and our racial equity partners. Julie?
Thank you, Madam Co-Chair and members of the COC committee. We are continuing our focus on the 4 priority areas of coordinated entry, persons with lived experience, data, and workforce. We are finalizing our action plans for each, which include actionable steps, outcomes, and timelines. We held our second monthly training session this past week, and the next ones are scheduled for January 19th, February 16th, and March 16th from 2 to 4 p.m. If you are unable to attend, recordings will be posted on the Racial Equity Partners website. We are also offering 5 racial equity and practice learning tracks in January, February, and March. The 5 tracks are for executive leadership, program managers, people with lived experience, direct service providers, and data specialists. An email containing all of this information with registration links has gone out to our COC mail list, and regular reminders will continue to go out. Thank you.
Any questions for Julie? All right. Next agenda item is updates from subcommittee meetings. So Julie Montoya and Steve Dudasek from MAG will provide updates on the data subcommittee, coordinated entry subcommittee, and ESG.
Thanks, Stephanie.
I can start on the data subcommittee update. The data subcommittee met this past week. Members held a roundtable discussion on identifying community data needs, and a work group of members will be put together to work with the HMIS team on needs, gaps, and data quality. The subcommittee also made a recommendation to add in eviction questions into HMIS to allow us to track a possible flood of first-time homeless persons that we may see after the eviction moratorium ends this month, and for coordination of services. That concludes my update.
Thank you, Madam Co-Chair. This is Steve Dudasek from MAG. I have an update on the Coordinated Entry Subcommittee. Right now, the subcommittee has been meeting to look at the governance of the CE manual, as well as policies and procedures manuals. The committee is looking to edit and change elements of that, which once completed will be brought to the CE, this subcommittee for review, and then to the board if this committee chooses to approve the changes. One of the things we are working at with in the Coordinated Entry Subcommittee is to ensure that there's a racial equity lens in all of the procedures and policies that folks working in CE can enact. So that's where we're at now. The next CE subcommittee meeting is on Monday, and we'll continue with that effort. Thank you.
Thank you, Steve and Julie. Any questions for either of them?
I'm sorry, Madam Co-Chair, I do have the ESG subcommittee update as well.
Oh, sorry, yes.
Our ESG funders have been meeting every other week since March to coordinate and collaborate funding resources to support the COVID pandemic response. This past month, presentations to the subcommittee were given on landlord engagement, housing costs and evictions, and rapid rehousing best practices, and ongoing discussion and coordination in these areas are occurring. Thank you.
Okay, now are there any questions?
Daniel Davis from UMOM. Julie, was there any feedback from the ESG committee members from the presentation or any of the best practices?
But yes, Daniel, I don't want to speak on behalf of the ESG funders, but yes, they did have a lot of conversation around the landlord engagement and incentives and how to coordinate, the possibility of funding that. As far as evictions, there is a lot of rental assistance that has come into the community, but part of the challenge is that it's, come and gone already, even as much as that has come into the community. Rapid rehousing best practices. I know that they are working with CSH on some of those, also to get provider feedback is part of that. So that's kind of the, the part of those meetings that I would be, able to share.
Can I have a follow-up question to Daniel's question? This is Laura. I'm wondering if the community and MAG is looking at revising the rapid rehousing financial assistance standards, especially in lieu of what's happening with COVID-19. I know that the best practices are around $9,000, and with the increases in the community and many of the landlords requiring first and last month's rent, as well as higher damage and security deposits, that's limiting the amount of funding that we can provide with families in a very dire time.
Yes, thank you for that comment. I think that we have to look at our policies and procedures as the times have changed and the pandemic has amplified homelessness. So yes, that is something that we intend to do, and obviously look at it from a racial equity lens as well.
This is Wendy Johnson from Justice Center. New topic, new comment. I am gravely concerned about the rapid rehousing voucher being used with those who are handicapped and or seniors because they go down in value and the rent goes up, but their income ability is not there. And so I've got a number of seniors who are facing homelessness again, not because they're not working, they are, not because they're not paying their rent, they are, but because their rapid rehousing voucher is expiring down on them. And we don't have an alternative that I'm aware of. And I spoke with the folks over at Ability 360 and they're experiencing the same thing. So I think this is a grave concern as we're moving forward. There's a big difference between me at 30 getting a rapid rehousing voucher and I have mad skills and can go back to work, and me at 65. So I think we as a community need to address this.
Thank you, Wendy, for your comments. I believe that, we should always be reevaluating the way, we use our vouchers and funding in the community. I think that that's, something that, we value your input, because I think we do, with times changing, we always have to reevaluate.
This is Laura again. I'm sorry, I don't mean to dominate the conversation, but this goes back to your original question. And I do think a group we left out, Brandy, in this conversation is the elderly and seniors. And we're seeing more and more elderly grandparents who are getting custody of grandkids. And I agree with Wendy that, rapid rehousing may not be the best option for some of those households. And we do need to come up with some alternative housing options for families who are multi-generational with older adults who are being responsible for grandchildren and may not have the ability to work and may be on a fixed income, either SSI or SSDI.
Madam Chair, co-chairs, and Laura, thank you very much for that suggestion. That's another good an area of opportunity I think that we need to explore and continue to get feedback from older adults and those, exactly like you said, with the eviction moratorium impending, we really need to be looking at new solutions and looking at different ways we can address the challenges that we're facing now and we're about to face in the future. So thank you so much for sharing that.
This is Michelle Jamison. I would like to just piggyback off that as well with the seniors, and they are on fixed incomes, and then also if they need like a higher level of care, like assisted living, that's just another difficulty because it's so expensive that a lot of them that need that additional care aren't able to access.
This is Stephanie from NEC. I think Laura's comment would be good to take to Coordinated Entry Subcommittee as well. And one thing I would ask to go to Coordinated Entry Subcommittee as well, there appears to be a gap in having people document ready to refer to housing. So if that could be added to the agenda, I would appreciate that. I do intend on attending the next meeting, but I do think that's something that needs to be addressed and just having a plan of action for that as well.
Thank you, Madam Co-Chair. This is Steve from MAG. Noted with the Coordinated Entry Subcommittee, your suggestion for an agenda item. Thank you.
So did we move to number
Thank
9
you.
for future agenda items?
No, I was going to ask if there's any other questions or comments for MAG staff. Okay. Oh, we got off track, Michelle. Any other, so we'll move to the next agenda item, which is future agenda items. Do committee members have any action or discussion items for January's meeting?
This is Nikki Ramirez with Chicanos for La Causa. Are we still carrying over? I know that there was a long list of agenda items or potential agenda items that were suggested back in October. So is that list still being carried over and like slowly trickled into future agendas? Okay.
Yes, thank you for bringing that up. There was such a long list from our last meeting. We knew we wouldn't be able to thoroughly capture everything in one meeting. So given what's going on with MAG and their ramping up their regional plan, we did prioritize some of the conversation towards that for today's meeting. And we will take some of those suggested agenda items from October's meeting, and we will be incorporating those. Thank you for mentioning that. You haven't been forgotten.
Yeah, Stephanie and I and Steve, we met and we went over a lot of them, and so we went back to the meeting minutes and then did that. We also are working as we listened and incorporating a lot of from the board meetings into our meetings and how we can provide that feedback as well. So I just, as a standing item, I would also think just the subcommittee updates on the agendas, but also the equity work groups as well. And I think that we could maybe just add to put discussion items like what we've gathered from the committee and what we're going to plan on implementing going forward as far as from the October meeting minutes. We can just discuss as like a discussion point.
And I guess by our next meeting, the first forum would be done, and maybe MAG staff could report out on how that went as well.
Thank you, Madam Co-Chair. That's a great suggestion, and we would be happy to come back, MAG staff would, to share the discussion points that we heard during that listening session. And we can continue to do that as we hold those listening sessions, come back and share with the committee what we heard.
Perfect. Any other agenda items anybody would like to see for January?
I just have
Hearing
one question.
none.
I'm sorry. I do have a question for Brandy and MAG staff. Has there been any updates from HUD on what the plan is related to the NOFA?
Hi, Madam Co-Chairs, and can I address Laura's question? This is Steve from MAG. Laura, the answer is HUD has not given us directive of what's happening with the NOFA moving forward. We do attend their weekly Friday meeting, and no information has been provided other than wait and see, and that they understand that COCs have been working very diligently to address the COVID-19 pandemic. But in terms of the NOFA itself being put out, that has not occurred, and it's still a wait and see process from HUD. And I don't know if my colleagues, Sarah or Julie, would like to add to that.
Yes, this is Julie Montoya with MAG. Yeah, basically what Steve said, they are looking to go to a non-competitive, non-renewal process, but they do have to get congressional approval. So I know that we're all keeping our fingers crossed that they are able to pass something this week and we hear something soon. But unfortunately, we don't have a definitive answer. I also did get some questions from some of the programs about grant agreements that were new grant agreements that were coming up. And I did reach out to our local field office, and I basically received the same answer, that they didn't have any directive from the higher ups at HUD as well. So we will continue to keep you all posted if we hear anything, as soon as we hear anything. But right now, that's kind of where they've left it.
Thank you.
All right, I think we can move on to the next agenda item. So I'll hand it back over to Michelle.
All right, so it's comments from the committee. Is there anyone on the committee that would like to have any announcements or events that they would like to highlight? Well, I guess I would like to wish everybody happy holidays. It's amazing that next week is the Christmas holidays already. I hope that everybody can regenerate, gain energy, and come back and fight COVID again. I know it's been very tiring. I can imagine with everybody with organizations and keeping everybody safe. We all have staff and we all have clients, and it's a big burden to put on everybody. So I am just thankful for if I get a whole day of rest. So I wish everybody have a nice, happy holiday. And I guess that we're adjourned, but thank you so much for the great dialogue today. Have a good day. Bye.
Thank you, everyone. Bye.
Bye-bye.
Bye.
Happy holidays, everybody.
Holidays.